This is an instructional video on the use and operation of the nitrous oxide oxygen analgesia machine. Briefly, we'll go through a short introduction as to the setup of the machine. Then we will segue into the safety features of the machine. And finally, we will demonstrate on a live patient the use of this machine. Everything starts with the tanks. The tanks are where the gases are stored, oxygen, nitrous oxide. From there, the gas flows through the regulators, 2,000 pounds per square inch for oxygen, approximately 750 pounds per square inch for the nitrous oxide. Regulators will reduce the operating pressures down to about 50 psi. From there, the gases flow through the flow meter. Varies with different manufacturers. This just happens to be one example of the flow meter. From there, the gases then are combined and flow through the outlet device, which contains an emergency pop-off valve and the reservoir bag, to the conducting tubing, which delivers the gases to the patient. The gas flows through the conducting tubules to the nasal hood. Again, different designs. This just happens to be one, but every one will have an important apparatus called the scavenging system. The scavenging system is here to remove excess nitrous oxide from around the face area, and it is carried away through the central vacuum system to the outside. By standards, the central vacuum system has to be operating at approximately 45 liters per minute of evacuation. Again, depending upon the manufacturer, there will be built into the system some type of dial. This one just happens to be a dial. Some of them will have a floating bead that you can control the volume of the evacuation, and it will have an optimal range noted on there somehow. If you do not have it set enough, the evacuation will be less than the optimal 45. If you have it set too high, you will be actually removing the nitrous oxide from the patient, and the patient won't be receiving the correct dose. We'll now discuss the various safety features of the nitrous oxide oxygen system. Starting with the tanks. This is a cart system. It is great for its portability, and especially if nitrous oxide is not used regularly in an office. Most offices that, if they use the system regularly, do not go with the smaller E-size tanks. They will have the larger H-size tanks somewhere in a closet or manifold system that would not contain all the yoke. It would just have the flow meter and the hoses, which need to be plugged into a wall outlet. Nevertheless, if you do have a manifold system, remember it is important not to grease the fittings because they are a little snug and it is tempting to grease them. However, that is an explosion hazard. So never grease the fittings on a manifold system. First thing you can see from the tanks is that this is an E-size tank, standard coating in the United States. Also standard in the United States is the color systems. Oxygen in the United States is always colored green. Nitrous oxide in the United States is always colored blue. This color system will vary in other countries. With the color system, you can see that that is carried from the lines that connect the tank to the regulator. Also, you see the second safety apparatus is called the diameter index safety system. You can see that the diameters of the two connections are different. In this case, the blue, which is the nitrous oxide, has a larger head on the nut than the oxygen, green, which has a smaller diameter nut. Another safety system built into the nitrous oxide oxygen apparatus is known as the pin index safety system. In the United States, there is a standard of 6 positions of these pins. You can see a set of pins here and a set of pins here. For oxygen, the arrangement is at positions 2 and 5, and for the nitrous oxide, the positions are 3 and 5. Corresponding on the valves of the tanks are the holes which receive the pins that are on the yoke, and you can see here on the oxygen, these are set farther apart than they are on the nitrous tanks, which would be a safety system because it allows for a safer configuration that would be difficult to mount this tank on this receiver and this tank on that receiver. Okay, another safety feature for the machine is the non-rebreathing valve, which is built in here. You can't see it, it's inside the machine. In essence, it's a one-way valve that allows gas that has been in the tubing from backing up and going back into the reservoir bag. One more comment general about safety with these tanks. It is set by the National Fire Code of how to safely store these tanks. Notice that these are mounted on the machine, which is fine. However, if these tanks are loose, there is a very strict way to store these. They have to either be in a very secure box or chained to a wall because these are under pressure. About 2,000 psi on the oxygen and 750 psi on the nitrous. If this tank were to fall over and this valve become damaged, this would turn into a torpedo and go through walls or ankles if it is in the way. The next step in the machine is the flow meter. You can see that the tubing bringing the gases from the regulator into the flow meter, examples of our color coding system and our diameter index safety system. The flow meter has several other safety features built into it. Number one, keeping in with the color coding, blue for nitrous oxide, green for oxygen. We also have the flow safe system. You can see that you can deliver 100% oxygen. However, you cannot deliver less than 30% oxygen, or the maximum amount of nitrous oxide would be 70%. Remembering back from your general chemistry, room air is approximately 80% nitrogen, approximately 20% oxygen. So by having a patient on this mixture of gases, they are receiving more than ambient room air for oxygen. Another safety feature on the flow meter is the fail-safe system. The fail-safe system is a series of valves inside this apparatus that cuts off the flow of the nitrous oxide if the oxygen delivery was interrupted. There is a valve in there that is kept open by the presence and pressure of the oxygen, which opens the valve for the nitrous oxide. So if the oxygen is depleted, this valve closes and the patient cannot receive pure nitrous oxide. The next safety feature is the emergency air inlet. If for some reason the flow of the gases was interrupted to the patient, this valve would open by the patient breathing, and the patient would be able to breathe in room air through this valve. Okay. One more safety feature built in here is the O2 flush button. What this does, it overrides the mixtures that are coming into the reservoir bag and floods the reservoir bag with pure oxygen. This is used only, again, as an emergency measure because by activating this, we are dispersing the mixtures of the gases into the ambient environment and could be inhaled by the surrounding folks. The next feature is the reservoir bag. This is a nice important feature because it allows us to view the respirations that the patient is taking. This bag should only be filled approximately 2/3, no more than 3/4 full. It should not be completely flat, nor should it be so distended that you cannot see movement in this bag. Another safety feature for the nitrous oxide oxygen machine is the scavenging system. The scavenging system varies with manufacturers, but in essence they will mount to the nasal hood and remove excess gases from this area out through the central vacuum system, which is delivered to the outside. I have a couple other examples of scavenging systems. You saw the one previously on the machine that we have here. This is similar to a disposable nasal hood. However, it only has one side hookup for the scavenging system. Another popular system is the autoclavable system. This is not disposable. This is reusable. In this system, the scavenging is from this outer liner, and this inner nasal hood is removable. And autoclavable between patients. Getting back to the nasal hoods, we have in essence two systems, either the disposable or the autoclavable. The autoclavable system, beauty of it is that they are autoclavable and usable between different patients. The disposable systems come in a variety of scents, colors, and sizes for the different patients. You can see starting here we have for a small pedo application to a more medium size and up to a very large size. The system should be checked regularly for deterioration of the products. An easy way of handling infection control is just placing a plastic bag over the entire machine when in use to protect from splatter from the operation going on. However, there are parts that will be exposed, so those need to be wiped down with whatever commercial disinfectant your office uses. We have already said that the nasal hood itself is disposable in this case, or autoclavable in other systems. But all these rubber goods need to be checked periodically. The ADA has a schedule, a suggested schedule for the timetable on this. At least quarterly, all the connections should be checked for leaks. The tanks should be checked with soap solution every time a tank is changed, and I'll demonstrate that in a second. And just the integrity of the tubing, making sure that there are no breaks, kinks, splits in the rubber goods. Okay, the soap test at the connections is fairly simple. You just make up a solution of soapy water and apply it to the connections. And if the tanks are not mounted correctly, you will see bubbles forming at the interface with the washer. This same test should be repeated periodically on all the other connections on the machine to ensure tightness. Some record keeping before the nitrous oxide is administered for the patient. Obviously we would do health history, review that. That must be signed by the patient and reviewed by the doctor. A sample of a standard informed consent agreement that from a medical legal standpoint informs the patients of the risks and benefits associated with this product, nitrous oxide. And some of the required information that needs to be entered into the patient's chart. Obviously the patient's name, date, age, ASA classification, indications for the use of nitrous oxide oxygen. In this case, this patient claims dental anxiety, so we would be using the nitrous oxide for the anoxiolytic properties of the nitrous oxide. We've also taken the patient's vital signs, which includes blood pressure, pulse, and respirations. We will repeat this during the procedure and again after the procedure is ended before the patient is released. Other things we will fill in are the tidal volume of the flow of the gases for the patient, the peak nitrous oxide administered for the patient, how long we administered pure oxygen to combat the diffusion hypoxia, any comments from the patients upon their recovery, whether it was positive, negative, and any adverse reactions that happened during the procedure, and then of course signed by the clinician. A common test to assess the patient for, during, and after the procedure is called the trigger test. In this case, a simple scatter diagram is plotted on paper, and the patient fills this out attempting to connect the dots. And this is the patient's pre-trigger test, and what we look for are how many dots and we will compare this pre-triggers test to a post and procedural triggers test. Okay, we're now getting ready to use the nitrous oxide oxygen delivery system for the patient. As you can see, we've draped the machine in a clear plastic bag, which would be acceptable infection control for the operation. You can see that not all of the delivery system, the conducting tubes, are covered. These would have to be wiped down and disinfected with each use. But for filming purposes for this instructional video, we're going to go ahead and remove this bag so that you can see the parts of the machine more clearly. Okay, the first step for the procedure is to inspect the machine, make sure that everything is in good working order. Again, make sure that all the hoses, the delivery units are clean. In this case, we're using a disposable nasal hood, so a clean nasal hood has been connected to the machine. The scavenging system is set up and is operating correctly, and the tanks have been turned on. See that we're showing 1,000 psi pressure on the oxygen side, 750 psi on the nitrous oxide side. As you remember, the state of matter that in the oxygen cylinder, this is all a gas. On the nitrous oxide side, it is a mixture of liquid and gas, and you do not know exactly how much liquid is in the tank until the pressure gauge starts to drop. So the tanks are on. We are ready to start the system. I will start the oxygen flow. And as you can see, the bead has risen in the oxygen tube, and we're going to start with approximately 6 liters per minute of oxygen gas. And you can see that the reservoir bag is filling, and it's at about 2/3 full. I'll make sure that everything is connected here, and I can hear the scavenging system working, and I can hear the oxygen in the nasal hood. At this point in time, I will hand this to the patient. Remember that the reason that we're using this is that the patient is anxious. So this way the patient has a bit of control over the situation. And you never want to hand a patient a nasal hood when there is no gas flowing through the system, because you have a anxious patient already, and if they are struggling to take breaths, that will heighten their anxiety. Let her place it comfortably. There is a system back here where this can be snugged up to the head. Some practitioners like it, some practitioners don't. They think that it would interfere in case the patient overdosed and had to vomit, that this would interfere with them turning their head to the side. But whichever way you feel comfortable, the first thing you're going to do is ask the patient to breathe normally through their nose. And we're going to focus our attention on the reservoir bag. Okay. Take a deep breath. You doing anything? Take a deep breath. Ah, there we go. We've adjusted the flow rate for this patient. Guidelines are 4 to 6 for adults. She was not breathing that deeply, so we brought it down to 5 liters per minute for her. And looking at the reservoir bag, you can see that it is filling and then deflating when she takes a deep breath. And so we're convinced that the system itself is working properly. She is breathing 100% oxygen at this point. So I am now going to introduce some nitrous oxide into the mixture. And we're going to start low. We're going to start at about a 10% mixture. This is a nice machine because the flow rate stays the same, but the percentages change. You saw that the bead on the oxygen side fell in proportion to the bead on the nitrous side increasing. Kind of the rule of thumb for titration of patient on nitrous oxide is to increase approximately 5% every 1 to 3 minutes. You can do that a little more rapidly at the beginning, but then as you're assessing the patient and as she starts to approach the ideal window of relaxation, if I'm going to make any further increases in my titration, I'm going to make sure that I have a longer period of time to assess the patient so I don't go into a over-sedation. I've watched her for about a minute, and communication is essential with the patient. You want to make sure that she's still in a good responsive state. So, how are you feeling?
I feel fine.
Okay. It's also important to remind the patient that the only way they're going to get any benefits of this is to breathe through their nose. They want to keep their mouth closed because breathing through the mouth would defeat the purpose of the nitrous oxide. And again, constantly watching the patient, watching the machine, making sure that everything is still in good working order. It's also important to, at this point, interject that there are differences between what is allowed by the State Dental Board for hygienists and assistants. Remember, assistants can only monitor, they cannot administer the gases. So the assistants cannot touch the machine. They can just monitor the machine and also monitor the patient. But operator must be present also. Okay. And Ms. Doe, how are you feeling? Any changes?
Fine. No, not really.
Okay. We'll go up to 20%. What I'm going to be a patient for is her level of comfort, reduced anxiety, make sure that the patient stays awake and responsive. As the patient starts to approach the ideal level of titration, I'm going to focus in on the eyes. The eye movements should become slower. Patient may respond that their extremities may tingle a little bit, feel heavy. Also kind of a general warmth and maybe a little vasodilation in the face and hands to where the skin will become a little more pink. Okay. Any changes yet?
I might be feeling it a little already.
Okay. And you can see that at a low percentage, 20%, the patient is already beginning to feel the effects of nitrous oxide. Remember, from the pharmacology of nitrous oxide, it doesn't dissolve in the blood, so it's an easy delivery. Goes into the blood-brain barrier quickly, and on the converse, the flip side, it comes out quickly. Research has shown that approximately 80 to 85% of the population ideally are at about a 30 to 35% nitrous oxide concentration. So she's getting close, so I'm going to increase one more bump, take her up to 25% nitrous. We'll leave her there for a couple minutes and see how she's doing. Well, Ms. Doe, any changes?
Yeah, I can start to feel the effects of it.
Okay. What are you feeling?
I still feel in control, but I am starting to feel a little hazy, I guess would be the best way to put it, floaty.
Okay. Remember that the prime use for nitrous oxide is as an anxiolytic agent. All this will do is reduce the overall anxiety for the patient. It will not be an anesthetic per se, although it can be used as an anesthetic in some purposes, but that's not the purpose of what we're using it for. We're just using this to make a better dental visit for the patient, less anxious. We'll check with Ms. Doe one more time. How are we doing?
Doing fine. I'm starting to get a little bit of tingling sensation.
Okay. So we can see that 25% would be a good dose for this patient. At this point in time would be a good time to, again, ask the patient. We always want to communicate with them that since you're starting to feel more relaxed, that this would be a good time that we're going to go ahead and administer an anesthetic at this point if the patient was fearful of injections. Following that, we would do our procedure. As a hygienist, you would be using the nitrous oxide on the patient while you're doing the heavier work, the scaling, root planing per se. But as we start to approach the end of the appointment and we're starting to get into the selective polishing, flossing, etc., we can start dialing the patient back off the nitrous and more onto the 100% oxygen. Since the patient came up easily, you want to take them down easy. So we'll demonstrate that, but before we do that, I just want to demonstrate the O2 flush. Again, you do this only as a last resort if the patient has gotten an excessive amount of nitrous oxide, because unfortunately it does a great job cutting off the nitrous and flushing the reservoir bag with pure oxygen, but it will spread the mixture into the ambient environment and then is available for everyone to breathe. So if you just keep an eye here and on the tubes, you can see that bag inflates, oxygen goes up, nitrous oxide comes down. But I could actually see her hair moving because it was, and that's also a little disconcerting for the patient, that air blasting around their face. We will now administer a mid-procedure trigger test on the patient. Again, vitals would be recorded during the procedure. If your office is lucky enough to have a pulse oximeter, that could be placed on the patient and periodic readings taken. So we will do a mid-procedure trigger test for the patient. And again, she will attempt to connect the dots. And at this point in time, we've started to bring the patient down off the nitrous, and I would continue with polishing, flossing, and since I took her up slowly, I'm going to also correspondingly bring her down slowly. And are you feeling the sensation going away?
Yeah, a little bit.
Okay, at this point we are going to administer 100% oxygen for a minimum of 5 minutes to combat the diffusion hypoxia that goes along with nitrous oxide. And so the procedure that you're performing on the patient may be done at this point in time. So you would be doing your post-documentation, initial cleanup of the area, but we are going to, by the clock, make sure that we keep her for a minimum of 5 minutes on 100% pure oxygen. 5 minutes has passed. The patient, we're going to ask her how she's feeling.
I feel fine.
Okay. So at this juncture, we're going to, since we snugged this up for the patient, we are going to release this. And we'll keep the oxygen flowing and let her remove the nasal hood. And then we can turn the oxygen off. Okay, I'll do one more trigger test. And you can see for the trigger test we have the pre where she missed 7, midpoint where she missed 10, and post she missed 0. So I would say in this case it's a simple neurological test to evaluate, and you can see that she is even better than when she started. And for purposes, we would fill in the rest of the columns here. We didn't take this because we administered a trigger test and for as short as a procedure we were doing, but there would be vitals taking midpoint, and then we would do post-operative vitals. More important, the volume that was set for the patient was 5 liters per minute. The maximum amount, the peak nitrous, was 25%. Paperwork does not say this, but one thing that I've always personally done is how long the patient was on the nitrous. So here it was just a short demonstration, but if the patient was on nitrous oxygen for 45 minutes, 50 minutes, that would also be noted. Recovery, patient's comments was that she feels fine, and we observed no complications, and then a signature from the clinician. And lastly, the machine is turned off. The valves turned off for the tanks. The nasal hood is removed one way or the other. If it is autoclavable, it is cleaned in autoclave. If it is disposable, it is either disposed of or in some cases given to the patient to bring back on future visits if they are going to be using nitrous oxide on a regular basis. Kind of a way to keep inventory down and keep costs down for the administration. The hoses and the machine in general are inspected again and cleaned and put away for the next time. And again, just asking the patient one more time how they feel.
Yeah, I had feels clear.
Okay. And we will dismiss.